New specialist alert. The latest professional to join the team at Peninsula Orthopaedic Associates is a father of 3. He is Italian. He says French fries are better than onion rings. Oh, yeah, and he's pretty good at joint replacement, too.
Dr. Anthony Falvello started at the Seaford and Millsboro offices on the 1st of the year. He's especially proficient in knee and hip replacements. Let's learn more now with Delmarva Life's Katie Cirilli.
Dr. Anthony Falvello has been hooked on orthopedics ever since he was a teen.
We actually, in my junior year, was fortunate enough to play in the state championship for basketball in Pennsylvania. And that got me interested in sports, and orthopedic surgery kind of follows sports. And so when I was in high school, I watched somebody perform a hip replacement, and I've been on the orthopedic track ever since.
That track took him to college in his home state of Pennsylvania. He then went to osteopathic medical school in Philadelphia, and after that did his residency in the Harrisburg-Hershey area. Not for a moment did he lose enthusiasm about his chosen profession.
What was really exciting was doing construction inside the human body. I've always been, even when I was a kid, I loved to work with my hands. And so the first time that I saw power tools and instruments that I had loved to use when building things with my grandfather used to help somebody get better internally, that was really exciting for me. The patient has a slightly abnormal shape to the ball of the hip joint.
And what he gets most excited about is performing total joint replacements and seeing those surgeries have a huge impact on patients' quality of life.
Joint replacements are a unique thing. You know, the joint, just like any bearing surface, can wear out. And what we can do is replace that surface with something that can provide, good pain relief and longevity for 15 to 25 years. Most joint replacements give a patient an 80 to 95% chance of getting very good relief, and that gives them incredible quality of life and also extends their ability to work longer and do things that they really want to do.
He specializes in knee and hip replacements, and for hip replacements, he's trained in the direct anterior approach, which is unique.
It's a truly intramuscular approach, and what that means is basically that after we make a skin incision, you can literally take your finger and push right down to the very front of the hip joint. We don't have to cut any muscles.
He's also passionate about the use of robotic technology when it comes to knee replacements.
When we're performing these joint replacement surgeries, appropriate positioning of the components, and specifically in knee replacement, the balance between the top and the bottom component is really critical. Most patients don't know, but a knee replacement doesn't have a hinge in it. There is no connection between the top bone and the bottom bone. So balancing the soft tissues around it is critically important, and the robot helps us do that. Back, all the way up. Good.
Patients will find Dr. Falvello at Peninsula Orthopaedic Associates locations in Seaford and Millsboro. He started at the beginning of January. He assures those in need of surgery that there's truly nothing to fear.
It's not like it used to be. It used to be a 3-day admission in the hospital, 2 weeks in a rehab center, a button that you would press for pain medication because you would be in discomfort. Here at Peninsula Orthopaedic Associates, we've really focused on minimizing patients' pain and speeding their recovery, and many of our patients go home the same day.
He adds that typically it takes 2 months for folks to forget they even had a hip replacement done, and typically 3 to 4 months for the knee. All right, it's time now to really get to know Dr. Falvello. Now, you're Italian.
I am.
Do you have a preferred type of pasta?
Oh, boy. Bucatini. It's got the little hole in the middle. It holds the sauce. It's good.
Music or movies?
That's a tough one. I think I'd have to go music.
Really?
Yeah, I think so.
That's good stuff. Now, you're not at work. What is your favorite thing to be doing?
I love hunting, fishing, getting out in the woods, being close to nature.
Are you good at hunting and fishing?
No, I'm the world's worst hunter and fisher. But it's fun to do anyway. I never get anything, but hey, I enjoy it.
Hey, you try, and that's great.
That's
you got
right.
a family?
I do. Yep, I have 3 kids. My wife and I have 3 kids. One son is at law school, and I'm very proud of him. And I have 2 younger kids, 8 and 6.
You have a favorite child?
Yeah.
Just kidding.
Not that I'd ever admit. Yeah, no. Yeah, no.
He might not have a favorite child, but he does have a favorite moment in the joint replacement process.
Having a patient come in and say, I can do this with my grandchildren, I can walk around the store now, I can do these things, is by far the most rewarding part of my job. Knee range of motion, we're going to bring you all the way back.
Replacing pain with the ability to enjoy life's greatest pleasures.
Side to side.
A fun fact about Dr. Falvello, Delmarva Life is not his first rodeo on TV. Back in his hometown, he ran a local show called Orthopaedics on Call, which dealt with orthopedic topics as they related to the general community. And I tell you what, Jimmy, that Katie Zerilli, she is throwing out the tough questions. Your favorite child? Come on.
Yeah, that's a toughie. Of course, then there was the onion rings and French fries. We probably better let that one go.